It's Pastor Chris with my brother C Single. We bring in wise words.
Grace and peace, grace and peace. This is Pastor Christopher Down Hannon. Welcome to the Wise Words Community Table. Today, our special guest is Anthony Garner, the CEO of Alabama Regional Medical Services. Welcome to the show, Anthony.
Yes. Hello, how are you?
We're doing really good. We're doing really, really well. We're excited that you are here on the show with us. Your work and your contribution to the community is huge. You have medical facilities throughout Jefferson County, St. Clair, Shelby, Blunt, all these different areas. You have medical services that actually service those that do not have monies or funds to actually have insurance to get this high quality services that you and your organization offer. That's huge, because a lot of people are suffering with insurance and the health insurance issues. What is it that you actually do?
Yes, sir. Yes, sir. We are a primary health care facility. We have multiple locations throughout the county of Jefferson, and we serve patients from Blount County, Shelby County, and St. Clair County. And we provide primary health care to indigent population. Those are people who may be underinsured or don't have insurance at all. Not only do we provide primary health care, we also provide women's health care as well. We have an OBGYN practice. Pediatric services are also a part of our service type. We also provide physical exams. We have a diabetes clinic as well. We also provide dental services and behavioral health services. Also, we also provide black lung screening. That's unique. You don't really find that in Alabama anymore. We have mines headed west, and so a lot of those miners and their family members come to our clinic to get screened for black lung disease. We provide the screening, send the paperwork off to the federal government, and the federal government makes the designation if they will receive the benefit or not. We also have housing assistance as well.
Wow.
Yes, we have apartments downtown Birmingham for folks who were homeless at one point or may have had substance abuse problems also. And another service that we provide is discounted pharmacy service. So people who need prescriptions, don't have the resources to get those prescriptions, they can come to our clinic, become a patient, and get those discounted pharmaceuticals. And we provide, so I don't consider ourselves just a medical clinic. We are a healthcare system.
Wow.
A small system. We're not similar to the UABs or the St. Vincent's, but we are a small healthcare system.
And well needed in the community. You just, in many words, spoke to providing a service for individuals that in many ways wouldn't have these services available to them because of price and cost and insurance. You're making this available, and not just any kind of service, but the best quality. You have trained professionals in those facilities that actually they give you the best care, and they're professional in what they do. So when you say that you having behavioral problems, those are the top-notch individuals. They qualify for that particular issue. Or if it's someone that needs eye care or foot care or women's issues, these individuals are not just someone that's out there random, but they're actually professional in their field, and they're providing this service to those that are less fortunate or don't have the money or the insurance to get this type of service any other way. That's extraordinary.
Yes, sir. Our providers go to the same schools, universities, graduate board certified providers, similar to the providers who work for the UNDERPRIVILEGed. They go to the same schools, pass the same exams. It's just that most of our providers want to come back to the communities and serve the population who are less fortunate. Our services are provided based on a sliding fee discount. So again, it's based on your income level and your family size. The majority of our patients receive the sliding fee discount at the most nominal fee. They can come in and get an exam done for as little as $30.
Right.
We don't turn anybody away. Even though they may have to qualify for the $30 limit, we don't turn anybody away. So if they don't have it, we still see those patients. For dental services, the nominal fee is $45. But again, if they come in and don't have it, we're still going to perform those dental services
Right.
for those extractions from those particular patients. So again, yes, our providers are certified, same schools, the UAB, the LSU, the UCLAs. So again, as far as quality of care, that's our mission is to provide quality of care to all who receive services from our organization.
Wow, that's very powerful. What I like about it is, excuse me, what I like about what you said is that, you know, you don't turn anybody away. A lot of people don't go to the doctor or even go to the emergency room because they're going to be billed so high afterwards. And some people can't even afford the premium if they do have insurance, excuse me. If they do have insurance, some of them can't even do the copay sometimes, and then they go without having medical service because of that. What I like about what you just said is that you're saying to those that need this care, don't let that be an issue for you, for you not to come in and get the care that you so desperately need. That's a powerful thing to have within the community. It's amazing how you actually went out, your organization went out in terms of this medical field that you're in and did the assessment within the community to see what they were lacking in and how you and your people can make a difference in those particular areas. How did you come to become aware of these different issues in the community? I mean, how did you assess it? How did you go out and say, well, this is what we need? Because you can go out and say that, you know, a community needs help and randomly pick a subject or pick a issue, and that may not be what that community actually needs, you know. And so even when you go to the doctor asks you, okay, what's the problem? Right. And my question to you, Anthony, would be, you know, how did you, I mean, you're right on. I'm not saying that, but you're right. But how did you actually get that information? What did you guys do?
That's a good question. What we do, we're mandated by the federal government to assess the needs in the community. Mm-hmm. So there's a lot of tools out there that will actually let you know where the indigent population is, and also what the needs are for that population of patients. We use statistics from the health department, the Jefferson County Health Department, St. Clair County Health Department. There's a federal tool out there. It's called a UES mapper to sort of let you know what the total population is in an area, what the total indigent population in that area, and how many of that indigent population is actually being served by the healthcare community. So we actually use stats. We use data from the health department, and also we do surveys.
Wow.
We do surveys. We go around, boots on the ground, physical boots on the ground, talk to people in the community, and ask them what the needs are. Work with people like you.
Yes.
Work with ministers. Work with business organizations, and ask them what do they see as a need in the community as it relates to healthcare. So that's how we make the determination of where to place a clinic, what services to provide in that clinic, because even though we have 7 clinics, all of those clinics don't provide the same services. Currently, our hub clinic that provides most of the services, with the exception of dental, is on the 7th floor of the Cooper Green facility. It's in the same building. The Cooper Green building is not the hospital anymore. It's a medical plaza now, per se. There's a lot of different organizations in that building now. But we're on the 7th floor, and that particular clinic, because the need in that area is so great, in that particular clinic, we provide our OBGYN services. Our medical director, Dr. Yakanda Clayton, is actually served out of that location. We also have pediatric services right there in that clinic. Dr. Moreo is actually our pediatric provider in that location. That's where the Black Lawn Clinic is. So again, to get back to your question, we do analysis. Mm-hmm. We look at statistics.
Right.
We get stats from the health department. We get stats from the federal government, also the state health department. we actually utilize data from these particular communities to see what the need are for that particular area.
Now, that's why we're here today. That's why we're here talking about ARMS, which is the acronym for his organization, which means
yes, Alabama Regional Medical Services.
Alabama Regional Medical Services. Mr. Garner, Mr. Anthony Garner is the CEO of that organization. He's doing a fantastic job. There's a whole lot more that I want to ask. I'm excited that you're here. There's a whole lot more that we want to get into. We don't want you to go anywhere. We want you to hold on right there. After these words from our sponsors, we'll be right back.
Wilder's Custom Built Ironworks. We build one-of-a-kind furniture like beds, tables, benches, end tables, chandeliers with a combination of wood, tile, copper, and unique designs. This can be the perfect gift for anyone during Christmas, birthday, anniversary, or just because. Send us a picture or even an image you have in mind that fits your personality or style. Send it to us and let us build your dream piece. Call us today for a quote.
Welcome back. Welcome back. This is Pastor Christopher Darren Haddon, and we're here, and this is the Wise Word Community Table with your host, Pastor Christopher Haddon. I have as my special guest, Anthony Garner, the CEO of Alabama Regional Medical Services, which is the acronym for that is ARMS. He's here today. We're talking about exactly how he provides medical services to those counties that he's involved in. We're having a fantastic time talking about exactly how he helps these individuals. Anthony, how do you actually not only meet the homeless? Let's talk about the homeless.
Okay. Yes, sir.
You know, right off the bat, my heart goes out to those that don't have a resident, don't have a roof over their head, and certain necessities of life. My heart, you know, as a humanitarian, goes out to those individuals because we don't know. It could be us there, but for the grace of God, there I go. You know, so I look at those individuals, and I my secular job, I actually interact with a lot of people of all walks of life all the time, but my heart goes out to them because they have so many different issues and concerns. We see them and we don't know their story, and some, definitely a lot of them have medical needs and medical issues, whether it's behavioral, drug abuse, if you will, many health issues.
Absolutely.
Now, many of them don't have a mailbox, a residence, or an address where you can actually go, or they can go and have literature and stuff come to them. How do you reach those individuals that in that situation?
Yes, sir. That's a good question as well. We work with homeless shelters.
Okay.
There's an organization called One Roof. It's sort of the coalition of all of the social services out there that provides care and social services to the homeless population. It's a one-stop shop per se. These organizations that provide services to the homeless population, they're members of the One Roof, again, which is a coalition. Okay. So a lot of homeless people, they have to register with One Roof. They have a card.
Okay.
In essence, and the ones in the shelter and the ones that may not be in the shelter, they have a card. But we work with a lot of shelters that provide services to the homeless population. We actually work with Jimmy Hill and the Love Lady also. Mm-hmm. They bring busloads of homeless patients that's in the shelter to our clinic on a daily basis. We have a homeless clinic downtown Birmingham on 25th Street North, and it's catered towards providing services to that homeless population. We also work with a local organization downtown Birmingham that provide care services to the homeless population on Saturdays. The homeless population is our heart,
right?
Our mission.
Wonderful.
Back in 1983 when we first started, that was the purpose of creating our organization, is to provide services to the homeless population. And that has maintained our core mission since day one.
Excellent. Okay. That's wonderful. Now, just to help get information to those individuals, there may be someone that know someone that goes to a shelter or may not even get to the, because there are homeless people that don't necessarily go to the shelters, and you know they kind of fall through the cracks sometimes, and they still need that help. But what I like about it is we're here and we have this audience, we have this platform, and there may be someone that may be watching the show right now and getting this information and may be able to carry it on and share it with someone that may need it. One of the questions in terms of, you know, we're going to deal with this homeless issue. You know, again, they have a lot of concerns. They have a lot of issues that go on with them. In helping them and bringing them in and giving them the medical care and treatment that they need, how do you follow up with them if they're not consistent, you know, in that particular facility, the homeless facility, if you will? How do you keep, you know, not keep tabs on them, but how do you, you know, keep track of the patients that you want to help?
Yes, that's a good question. If they're not in a homeless shelter, then it's difficult.
Mm-hmm.
So we have a mobile unit as well. And periodically, we'll let that mobile unit sort of travel throughout the city of Birmingham, where we know homeless people reside at. Obviously, under the viaduct is one of those areas.
Right.
So that mobile unit is utilized to actually take the health care out to those facilities. Again, if a patient may have received services at our homeless clinic, and if they need a prescription or something like that, most of them will come back to get that prescription
Okay.
at our homeless clinic. So even though they're transient,
Mm-hmm.
if there's a follow-up as far as the medication goes, which most of the time it is,
Mm-hmm.
they'll come back and just to receive that particular medication. A lot of times too, we have cell phones for them.
Okay.
You know, the federal government gives everybody a cell phone these days.
Wonderful.
So we also utilize our outreach department through our care coordinators to call.
Mm-hmm.
If there's a follow-up to something critical, let's say we to the lab,
Mm-hmm.
and the lab came back critical, or positive in that particular case, we'll call
Mm-hmm.
to ask them to come back so that we can provide additional follow-up and treatment for that particular condition or diagnosis at that particular time. So it's difficult, but we have ways to reach out to them. We use one roof as well. If there's another critical issue or positive or a lab or X-ray or something like that, we'll do it. We'll exhaust several options, several possibilities to reach that patient.
Okay. Now, if you like with the pediatrics,
Mm-hmm.
the children,
Mm-hmm.
they come in, and a lot of times they may be underprivileged and not have proper nutrition. And doing an examination on these children, and that comes up, and wow, they're just not getting the proper nourishment. And you know, what is the steps that you all take in that case? I mean, you got the medical report, and it's a malnutrition or a nutrition issue where they're not getting the proper meals, or they're not being fed consistently. They're missing meals. What do you do in that type of with the children?
If our pediatrician sees an issue
Yeah.
that may be considered neglect,
Right.
we're mandated to call DHR.
Okay.
Yes, we're mandated to call DHR. We haven't seen too much of that in our clinic, probably none at all since I've been there. But we are mandated to work with DHR in that event. If we see a kid that comes in that appears to be weak or something like that,
Right.
if we have seen one of those cases,
Wow.
we are mandated to contact DHR.
Right. Because you know, children again, another
Absolutely.
dear to my heart. You know, we want the best for the future, and that's our children today. So we want to be there for them. But again, with all this said, there's a lot of stuff, a lot of things in the community in terms of health-wise that we can prevent. if we just do certain things. But a lot of times, either we're not motivated, we don't have the knowledge of what we need to do, we're not inspired. How do you, on the other end, go from, the proactive instead of waiting for things to get bad? How can we prevent it? And we'll answer that question. We're going to take a break. I know we're getting into it. We're taking a break. We'll be right back after a word from our sponsor. God bless you. Grace and peace, beloved. My name is Pastor Christopher Dow Hannon from Pastor Chris Wise Word Community Talk Show. I would like to offer you the opportunity to place your ad for your business in our magazine, Wise Words Community Table Magazine. You can place your ad in this particular magazine and give back to your community by calling the number on the screen. First, let me ask you this, Anthony. What is the most, there's so much you're doing.
Right.
You're doing a whole lot for a whole lot of people, and I know God is smiling on you and your people. But here's the thing. What is it that, I know it's going to be a lot that you can say this to, but what is the main thing that you're most proud of that you all have accomplished over the years of providing this service to the community? What is it that you look back and you say, you know what? I'm glad we did this.
You're going to think this is a cliche. But I have to say, providing health care to the homeless population.
Wow.
It's who we are. It's who we are. It's what we do. It's what people know us by. Providing health care to the homeless population and providing health care to the innocent population as well. We are just so proud of that because you'll be surprised. A lot of us are one paycheck from being in that same predicament. Yeah. And so I'm just so grateful to be able to lead an organization that whose sole mission is to take care of people from a healthcare perspective,
right.
A social service perspective, a behavioral health care perspective. I'm just so glad to be a part of that. And I can't say it enough. I'm not trying to recreate the wheel. Mm-hmm. I'm not trying to do more than what we do. I'm not trying to step out into other arenas, other industries that I don't know anything about. Right. I want to be good. We want to be good at providing health care to the indigent population, in particular the homeless population. Wow. So we don't do this on our own. There's no way that we can pull this off on our own. There's a lot of other partners and entities that work with us that support us in our mission. Again, folks who don't have resources to reimburse us, that's where the federal funds come in at. But it's not all. It's not our total operation. We have to get out there and write grants. We get grants from the health department, other foundations and things of that nature that help us provide this care. But again, providing that care to those individuals, it makes me proud. It's why I get up every morning and go to work. It's why I'm proud to go to work.
We want all of our friends and loved ones to come out and show their love and support because this is beautiful what God is doing in this particular organization. Now, he already stated that they're not the only ones that do this, but they are doing it. And so whoever and whenever we can find our hearts to be able to support that type of work, we need to do it. And we do support. But here's the thing. We need to let them know exactly how they can get in contact with you and your people so that they can take advantage of what's out there for them.
Okay. Yes, sir. Yeah. We have multiple locations throughout Jefferson County. We serve patients in a 4-county area, Jefferson County, Blount County, St. Clair, and Shelby County. Our main location, as I mentioned, is our Arms Midtown Health Center, 1515 6th Avenue South on the 7th floor of the Cooper Green facility. We're open from 8 to 5. You can call 205-407-5600. We have a clinic in Crestwood as well, in the Festival Shopping Center. It's at 7001 Crestwood Boulevard, Suite 822. Open from 8 to 5. You can reach us at that location at 205-421-9615. We actually have a clinic right next door to you in Ensley.
Excellent.
Yes, on 19th Street, Ensley, 417 19th Street, Ensley, 35218, open from 8 to 5 as well. We can be reached at 205-783-9300. We also have our homeless clinic, which is downtown at 712 25th Street North. It's actually open from 7:30 to 4:30. It's open a little earlier because we work with the shelters. They bring their van of individuals to receive health care early in the morning. And we'll see those patients from early in the morning during the evening. We close at 4:30 there. But we can be reached at 205-323-6311. We also have a clinic in North Birmingham. It's called Northside Health Center. It's open from 8 to 5 as well, 205-731-2245. We also have a standalone dental clinic.
Wow.
Over by the Civic Center at 1333 19th Street North. We can be reached there at 205-322-8288. 8288. And we have a pharmacy. Like I mentioned, the pharmacy is on the campus of our Metro Clinic, which is our homeless clinic. We have the pharmacy there to make it convenient for the homeless population. Pharmacy has a separate number, however. The address for the pharmacy is 712 25th Street North, downtown Birmingham. It can be reached at 205-439-7233.
Wonderful, wonderful. God bless you. We had a wonderful time, Anthony. Thank God for having you on the show.
Thank you for
we
having
really had a pleasure. I know that's a lot of information. Well, we thank our listening audience, our viewing audience for joining us today on Wordz Community Table with yours truly, your host, Pastor Christopher D. Hannon. Remember, walk in love, peace, and don't let nobody take your joy. God bless you. We love you.
It's Pastor Chris with my brother C. Single. We bringing wise words. Yeah. Hey yo, some MCs like to brag, they like to boast, they like to talk about who got the most materialistic value. Must I remind you, can't take none of that with you. Much respect to those who come correct and never neglect to focus on family. Father, mother, sister, brother, love is the message we bring to others. Miracle concepts, precepts, we keeping you in step, you know what I mean? Wise words seeking the love around the world, all around the world, people need love. We shine bright, light it up like fire. This ain't no game, we came to aim higher. Leave the negative rhetoric far behind. All those inclined, hold up the peace sign. Wise words, wise words, wise words, going worldwide. Wise words, wise words, wise words, going worldwide, yo. Wise words, wise words, wise words, going worldwide. Wise words, wise words, wise words, going worldwide, yo.
Has played the background, and wise words gon' bring it back now. Lord knows we putting it down. Breaking news from town to town. Breaking news from town to town. First rule.